slide though. Yeah. So again, the key message here is for each of these things, individual companies cannot do much. As I was always saying, even for research, we need collaboration. In this kind of e-waste recycling, Denmark had a project where all the relevant companies were part of that. Right? So they were doing this pilot work. So there are large electronic manufacturers. There is a waste management company. There is another recycling company. Plus there is a platform company who are together doing this e-waste recycling project, mainly to automate that process of recycling and developing technologies for this. So the collaboration in Denmark, it happens pretty well, and these kind of things are needed. It's not an individual company's responsibility because there are so many different things involved. The materials are different, the technological solutions which will come up are different. This clearly you need a logistics partner and so on. This one again, I think there is an NGO which is working. I have seen, I don't know to what extent, what is their reach, but it's primarily within Delhi. This one I will skip. Then a few, this one paper is highly cited, Journal of Business Research. I didn't use these cases there, but I was, while writing the process of the paper, we looked at, and then we had a few companies where we looked at what they were doing. This is again an example of how through design companies were improving sustainability and ensuring more recyclable use. So, this is a very useful material they were using, which is relevant for Indian context. Lot of agricultural waste, even maybe whether it's stubble I don't know, but in their cases they call kind of tree waste, either old trees or something. Then they convert into a bioresin, and that resin is used to print furniture. So it's not the direct wood, maybe it's a kind of waste wood to resin and then to furniture. And lensing and Wellspun, you know. So lensing was the first one. Lensing is again an Austrian, mostly yarn producer. So they started doing the blockchain for traceability in cotton supply chain. And then Wellspun we have seen yesterday. Wellspun also moved into that direction. I will skip this part, and this was the part of research I was talking about. So 2017, 2018 I was trying to look at how digital technologies were helping in sustainability and resilience, and we looked at many different companies. We created a list of those, and finally I could manage to contact these four. This was kind of just before COVID, but and then we followed up during the COVID time with the interviews. So these are very interesting companies, and some of them will have relevance for India. The first one I mentioned, this is a coffee company. So, but they are not producers of coffee, but they develop the technological solution to have that traceability in the coffee supply chain. The second one was Plastic Bank, we already saw that. The third one is also very interesting. You don't know, and I didn't know to what extent the problem was there. So in ships also you get the fuel, right? We get all the fuel delivered to the ship for its purpose. It seems that also passes multiple hands from the refinery. When it goes to the ships, it is already sold multiple times because the crude prices are changing so much, and then people take advantage of it. There are a lot of unscrupulous players who are there, who mix, who sell adulterated fuel to the ships and the shipping companies, and when it is delivered to the ship captain or the ship engineers do not have any equipment to really test what is the fuel quality. Even for big shipping liners or even logistics companies. So this was a big challenge. So adulterated fuel is delivered to them, and obviously any adulteration for a ship and the ship engine, it is very detrimental to the quality, and many times ship are out of, they have to be repaired and they face severe damage. So and it's a multi-billion-dollar loss, you can see, but nothing had been done to solve that problem. So this company, it's called Bunker Tress. So they had some chemical solution, oligonucleotide or something, they said. They put it in the fuel and they traced from the refinery to the ship when it's delivered. There, with a simple handheld device, the ship captain can actually check whether it's the same fuel or not. which has been delivered from the refinery to there. So that is the level of traceability, but it's a very, again, it seems notorious industry. These all the other players who are there are very powerful and almost like mafia. So it's very difficult to penetrate, but I think some companies, some shipping companies are already using their solution. So the other one is even scary for us. Aircraft parts also they are traded by people who have nothing to do with aircraft industry. So even engine parts, not a full engine, but engine parts are critical parts of aircrafts are sold multiple times. Some old aircraft, maybe from a big airlines company, it has already passed few years and gone through enough life cycles. So they will sell it off. So that part is, they don't want to use it, they will buy a new spare part or whatever. That part they will sell it off. And then some other small airline, that's why all these airline accidents happen, you see in Nepal and Ethiopia and Indonesia. Smaller airlines companies are buying these kind of parts, and there are middlemen who are selling these parts in a kind of grey market for fully yeah, for a flying aircraft. Obviously there are regulations, there are very high flight safety regulations. So you have to submit, you cannot just sell it like that. All the maintenance documents, history, etc. have to be submitted, but it seems even those are tampered. Sometimes the documents are not submitted, and if the regulation is lax in some countries, they will buy. So Honeywell obviously is a big player, Honeywell Aerospace. So then they created a platform where you can actually buy and sell this from authorized players, and they digitized all the maintenance records, and they could see it and have the traceability, and matching the buyers and sellers in this, so that you can buy the right parts. And the outcomes were all very good. I think case you can see that the coffee farmers got 20% above the cost of production. Previously they have hardly got any money. This one also provide end-to-end traceability to the supply chain. So people like Unilever or others who are buying, now they are fully sure that this is 100% recycled plastic. This case, it avoids the unscrupulous practice of fuel adulteration, and go direct trade also, it reduces risk of human error in going through the maintenance documents, and removed kind of the spurious sellers from the market. So what I was more interested is what is the process by what is really needed to make these solutions work, right? So from these interviews, then it's a simple framework. So they adopted in this case blockchain, but what are the kind of mechanisms which are needed? Some are technical and outcome based, but this is also beyond a behavioral mechanism. Some of you are kind of psychology and other students. So this is still, many of these technological solutions to work, you involve locals and building relationships. These kind of things are important, and adapting to the local conditions, as we are seeing. Many cases we are saying, oh, whether it works in Indian context, how do we involve the local, any technological solution to make this work. I am increasingly seeing these things are more important, right? Developing user friendly interface or customized solutions, it's fine. Then it will get the impact, but also you need to understand what is the level of information asymmetry, what is the goal conflict. Clearly between players there are goal conflicts, right? Nobody has the same goals. And what is the level of task programmability, means what is the level of detailed task the person has to be done, and how can it be codified and given clear instructions, right? Without those clear instructions, this will not work. So lot of effort is needed to make any technological solutions work, both on the outcome side as well as on the behavioral side, plus taking into account, that's why these things we call as moderators. So this will impact the relationship, to what extent. This is what we found out. And for the these are, so we had two outcomes. One is more social sustainability, in this case improving resilience, so reducing quality financial and human error risks. There again two simple things: educating customers and engaging with customers. As we have seen, we have come across these points even in these last 3 days quite extensively, right? Educating customers, we know this, but through these few case studies I could also show that this is relevant. So this was published. We had 3 papers in blockchain related work, and then this another Journal of Business Research paper. Journal of Business Research paper I am not going through, the slides will be there, you can have a look. There also I looked at the resources and capabilities for circular economy, and digital resources and capabilities for digital transformation. So many of these small companies, their idea is based on circular economy, right? and they are trying to provide some value to customers. At the same time, they are also using some digital resources and capabilities. So how do together they provide that value, and what value they provide, that was what I was trying to see, and what capabilities do they need. So these four companies, that's why I know them well. So I interviewed them quite extensively. Westware, Plastic Bank, you have seen all of this. Filamentive, I didn't talk much. So they are using recycled filaments for 3D printing. Since I do a lot of work on 3D printing, I already knew them. So this is also a local UK based company. So for there, you have seen all of these companies now. We again created a very detailed framework. So what are the different resources and capabilities they had, both on the circular economy side as well as the digital side, and how they provided the value and what kind of capabilities. This is more of theory here. So there is something called dynamic capability theory. Within this we have exploitative and explorative capabilities. So exploitative means you already have those, you are kind of already exploiting. Explorative is kind of additional new things which you are adding, and some are more adaptive. As things are happening, you are changing. So you could see what additional capabilities are needed. This is not so much practical, this is more of business research, but those many of you are research scholars, so I thought, so this is one way when you are doing kind of qualitative studies, finding out the right companies, collecting data, coding those interviews, and then coming up with kind of theory driven propositions or frameworks is kind of important here. So with this I will stop, and okay, there are few more things I have missed, some future research, but there are some interesting, we again discussed these things. This is also one of my favorites I was talking about, right? In textile we have not talked about. There should be some opportunities, and this we have been doing for many years. In Bihar and Bengal, both sujnis and kanthas are quite common, right? But we have not scaled this up. This is still kind of done at a home level, right? So there should be, and these are quite exquisite products, should be high value but recycled. In general, the nature is all products are anyway recycled, right? But there are some also additional usage, right? How to improve the market access, this is primarily on the marking side and creating social empowerment, women empowerment. But at the same time, there is a supply chain problem here. How can unused clothes be systematically collected, processed, and used for clothing, bedding, and also for relief and for humanitarian purpose, right? So these kind of studies I think we need to do, and there are some business opportunities around this, I think. So I have listed some few interesting research problems which you can work on if some of you are interested in this topic. Plus I have given some other readings. One topic we didn't, which is closely related to circular economy, we didn't discuss, is called industrial symbiosis. We were discussing yesterday, no? So the waste stream for another is used as a raw material for others as a secondary source. So this is called industrial symbiosis. Again, multiple companies are together. It becomes very difficult, even in UK I have seen, it's very difficult for a company to find out who will take their waste material. So it is a waste for them, they want to dispose, that's why you want to give it to the waste collectors, but they are not the people. There may be some other industry who is actually searching for that material. This is a waste for you, but I can use and process that material as a raw material input. For that matching platform I have not seen, not so much, maybe there are few. And one company gave us a project, for one MBA student did a project. So even there is a car seat manufacturer, when they make the car seat, there are also lot of waste happens. So that waste is kind of this is also polymer material, different kinds of material. So where those can be used. So the student did some study what different kinds of potential applications, key rings or other things, even leather bags or different things you can make. But it was difficult for a car seat manufacturer to go and find out who is going to take their material and also at a right price, who is going to arrange this logistics. So there is an interesting problem there. But again, because I lived in Denmark, I know this is very systematic because it's a very small country. So these things happen. There is a, you can see there is a area called Kalundborg in Denmark. It is famous for this industrial symbiosis. So all the companies there are kind of feeding from each other. They receive the waste from each other, use it. So there is a petrochemical company, few pharmaceutical companies. All of them are kind of using each other's waste streams and other things and using it. So it has been there for many years. Those kind of even clusters are possible. When you create clusters, we might even think of in that way where the waste or the material can be used. Can it be used in that local area with minimal transportation, right? So those are certain things I wanted to talk. Okay, we will stop for this part and move on to social entrepreneurship. Which is not really my area, but I like reading about these companies and do have a few papers which is mainly based on IQR because I knew them. And this IQR company, how I found them is also interesting. So they are in Kolkata, only few kilometers from where we live, but I found them in Denmark. So they came to a World WHO conference and I attended and I found them. And since then, since 2015, now I know them almost 10 years. You can see they have been doing very exemplary work. Little bit you will see in that case study. This is already old. I wrote them in maybe 2018 or 17. It's already old. They have done a lot of work. Now, social enterprises, why government is also pushing is they know it's not government cannot do everything, but many of these things can be done by social enterprises where they also create certain impact, and some of these obviously can be profit making, but at the same time they are in a way supporting government's mission, right? So the objective is to develop into social economical prospering community with lowering level of resource consumption and public expenditure, and they are addressing this. So what we call in an academic language, strategy literature, they call as institutional voids, right? It's not possible from an institutional framework like governments to address every possible need. So there are a lot of these voids. We cannot do this as a government. They are failing to do. This is where wherever institutional voids exist, some entrepreneurship opportunity comes up because government is not able to do, and these problems exist. Can we solve this, right? So that's why these enterprises come up, and they come up this social change using bricolage and social innovation. So what does this word bricolage means? Bricolage means getting ideas from different places at a low cost possibly and combining them together to come up with something else. So it is kind of piecing together that solution broadly. Many of them, as I said, can be for profit, innovative, and new business models are developed, and they are measured on not necessarily profit. So it's social impact, the reach and the breadth and depth of the impact and scalability is what is more important for social enterprises, right? And NGOs sometimes are actively part of that network of companies. Now this paper I read and I found it interesting. That's why I took all the 3 cases from that paper. So I think I have mentioned, yeah, it is this paper, quality research in organization. It's not a big red journal, but the cases are very interesting. Have you heard any of this? Nepra, Piramal, Sarvajal and Garv toilets? Piramal is quite now well known. So these are 3. Nepra is kind of West Calcutta. They are not the only one. Now there are many such companies, but they have done this. They are quite early and they are quite big now. So they have many waste collectors. They formalize this, as I was saying, and they had facilities for recycling. Plus they also have this refuse derived fuel. So they created a fuel and they sent it to the cement companies, as many of you are saying. Piramal is very interesting. They have this water and also the Suchak system for monitoring, and then kind of ATM, water ATM, right? Garf toilets is also similar. One of these is they have this biodigester tank, but they have different models for schools and for women and community toilets. So what this framework showed, and in our paper also we had kind of similar things. So the driver for many of these is institutional voids. Then they come up, the social entrepreneur opportunities come up and they create these enterprises, but to create scalable solution they need a equitable platform. They have they collaborate and partnership many of these with this with NGOs, and together they can create. So this is a simplistic thing, but from their model, again through the cases, they showed how this model worked. As we are also discussing, irrespective whether it's a social enterprise or not, scaling up for startups is a big challenge, right? And many of you will be interested in startups or developing or even studying them. So they always see that there is at some point of time they are not able to go beyond a certain level, or they are currently simply winding up, right? And this is called this valley of death. It's very difficult to scale up and then again further scale and create. So there are many problems which this kind of companies face. Social enterprises even more. So spending too much at an early stage, if they have got on spending too much time on customer acquisition without the product market fit. So maybe they have a problem, they have an idea, but whether there is a real need, what is the extent of the market, and whether their solution is actually targeting them. People have good ideas, but they are able to not able to really make that product market fit well. Then again, as I said, building a product without the problem solution fit, adding a lot of nice to have features, investing into scalability before that fit. So these are all early stage problems. Then once the people have money, then they go berserk and try hiring a lot of people, good salaries, lot of VPs, not many people to do the work and so on, right? Hiring too many people, early specialists and so on. And then at some stage they focus too much on profit maximization, not adapting the business model to changing. Lot of things are happening, and by that time 4, 5, 6 years have spent, and they really have not been able to really scale up. Sometimes many of them wind up, right? So clearly, when scaling up, there are few considerations which I mean I am not really an expert, but what I have read is this go-to-market plan also to understand over a period of time, not just for now, but in future how these things will shape up. The roles and responsibilities clearly defined within the team, hiring the team with the right skills, and also analyze. Many of these are digital services, so they should always have a plan of how to analyze the data coming from the services, not just providing the service, but also seeing who are using it so that you can constantly upgrade and improve the service. Test and demonstrate the benefit. We have been talking about it quite a lot. So the impact assessment is important. For further funding, they want to see not just the numbers in terms of how many customers, but what is it that you have provided to them. So, and attracting external funding at the right time. External funding very early is very also problematic. Right? This is the only operations paper we have seen related to startups and on entrepreneurship. So again, I mean, we study processes. So this is they said even startups need this kind of processification. It's difficult to say, but if everything is so ad hoc in startups, they don't really follow any process. So level of automation, segmentation of who is doing what, market segmentation is important. Creating a platform, professionalism, culturalization, collaboration. So this they studied a few startups and they came up with certain things which is very tangible and they should do. But these things are missed. It's good to have the idea, you may have fun, but many people kind of don't develop the process because I mean they it's a very entrepreneurial mindset. Very people are kind of young people or whoever is doing this, they don't invest time in creating that system, also thinking that if you create too much of process then it becomes bureaucratic at certain point of time. But some minimum level of standardization and process is needed even for startups to kind of go through the early stages. Then we will come to the IQR case. So we just have, I just brief you a give overview. This is old data, as you said, I wrote the case quite early, but things not of some of these numbers might have changed, but broadly 70% of Indian population still possibly live in villages. Average distance to hospital is quite large, significant shortfall, and this is what they found out. Why they started this is we know that in rural health is a big problem. The public primary health centers are there, but not there fully functioning. Either the doctors are not there, and 9% they don't have any doctor, they don't have technicians, they don't have pharmacists, though everything is there on paper, they should have. But these are severely understaffed. Even IIT hospital, you are not able to recruit doctors, right? So then what will happen to a local primary health center? Nobody has incentive to go and work in these places. Plus, people do not have insurance, and this is they have to travel more than 5 kilometers to go to the nearest one, and sometimes even for a larger district hospital, you can imagine what is the big. So people have to sell off, and this I was telling why he started this is also he lost his own father. I think he is also from Mednipur. This is actually IIT Kharagpur incubated startup, IQR. So, but he was working I think in Oracle, IBM, and he had this passion, so he started this. So they are trying to solve this last mile healthcare delivery, only primary healthcare, but they are connecting for secondary and tertiary needs. So they run these rural health centers backed by remote monitoring technology. So they have created a hub and spoke model, as you have seen. So they have some hub clinics nearby, near a railway station where some better connectivity is there, and from there they send their team to the nearby villages. They created proper clusters who will go to which visit, which villages are in their cluster of that hub, and so on. And they send a team of then doctors and paramedics and others, but they also recruit mostly from the local villages, typically women, and they train them to be, so they give them a device like this now, that time tab, but now they carry a bag and many other kind of medical devices. So they are going and try doing the primary health screening, right? And many, because even in cities, I was saying that people do not want to go to doctors unless it is already quite serious, because they don't know and they have not checked, they don't know what is the situation. So they are now collecting this regular, even basic BP, sugar and other things, and then the data is already there in the system. The doctor can look at it from the clinic, and if there further intervention is there, sometimes they are doing through telehealth some consultation. If needed, they are bringing them to the hub clinic, and sometimes they are referring it to other secondary hospitals, and they have some collaboration with others. But over a period of time, they have added many different tests, and there are some areas they are focusing on certain things. Mostly they are now doing a lot of maternal health, child health related work, but also other things. So their system is called wireless health incidents monitoring system, but now they have upgraded. They now have tie up with IBM. Everybody wants to work with them because this is a mine, gold mine. So much of rural population, pharmaceutical companies all wanted to collaborate with him, but he has not said yes to them, because once they get in there, they can be very difficult, and you will lose trust. Health is such a sensitive issue. It's a very local issue also. They are trusting him and this company, but suddenly if many other companies come in using that platform, they will kind of lose trust. So he was not very comfortable allowing the pharmaceutical companies to come to his platform. But others, some like eyeglasses and other things, they are also doing. So, and this system, it works also on very low bandwidth. Even if there is no internet, the data can still be there, and whenever the internet access is there, you can do it. And they are doing, I have visited, they primarily started from Medinipur, but there are few other parts of West Bengal, but also Jharkhand, Odisha, I think Nagaland and Karnataka, some places. But now he has expanded to many parts. You can, if you search, Middle Eastern countries, Southeast Asian countries. And when I was in his office in 2017, he got a call from Mexico. Somebody read about him, and one of the states in Mexico, the health commissioner or somebody actually called him up. Can you set up something in Mexico? That time he was very small. He said, I cannot even go beyond my district. For setting up something in Mexico, this is a local health issue. We don't know language, so he could not. But now they are quite famous. They got a lot of funding. He got lot of awards. Now I think he goes to Oxford, MIT, many places. But you can see when he comes, sometimes we can also invite him. He is anyway from Kolkata, but he is originally IIT Kharagpur startup, so he will be happy to come. I can connect you. So there are few questions. So now you can again, like yesterday, let's spend some time work in groups, dividing in yourself who is answering the questions. You got the IQ or case questions, right? It should be there. Let me just show this. Yeah, there were some 7 questions. Let's see how many of these, all of these you may not know. 7 or 8 questions I had put in the original case. Yeah, that is also fine. এটাকে একটু
No, it's visible. Can you see? এটা কি? So this one.
এইটা এই নিচে এই চারটা this 4 and the bottom 4 ওটাকে তাহলে নেক্সট পেজে করে দিন
Okay, let them finish and then.
হ্যাঁ
See, after finishing, just you tell me more 4 questions are there. Okay.
total 8, so 4 and 4, but he is now keeping the screen at 4 for online purpose.
Reusable.
And then
Double pages.
No, you cannot split it.
no, you just see it. But you should have already got this document also earlier.
Questions we have, sir.
हाँ ठीक ठीक है.
So technologically you can't do that, like splitting.
No, this is actual live streaming. No, I don't want to disturb anything.
You are doing 1, 2.
So we are taking 3, 4.
Yeah, I'm already done 3.
Acha.
That's what I was saying.
No, what
They want that all questions in one.
That's what I was saying. You putting in one page, next page, everything will come.
Third of he is asking for splitting this to it.
Ah.
do that is 1 to 8.
Oh, 3, 4 done.
3, 4 you have
Oh,
done.
3 done.
Oh, no, you have to
You
do
do 3,
2.
4.
3, 4 you do.
Then you are doing 5, 6. Then you are 7, 8, 5, 6.
But you are taking 1, 2. If they are doing 5 and 6. But हमारा तो सबसे difficult हो गया. थोड़ा ले लिया.
There is a difference between student and professor को ही सबसे ज़्यादा दे देंगे ना आप. हाँ.
So can you zoom in the
हाँ yes. इसको no. गूगल में ना इसको zoom in. तो font change हो रहा है इसको zoom.
I gave, we had 3 copies when we all were. No, 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 I can understand. I will try to with small differences, that's nice.
The case also, then I can show it here, then I have to remove the questions.
Sir, I know.
You can remove the question.
No, but there is just one page, right?
Then I have to scroll down.
If you can tell me approximately what is your father's age basically. I was talking to a doctor for the medicines.
Oh, okay. His age is 86.
86.
Did you get the other details? The two medicines and the condition. We can start with the earlier questions. It will take time. So maybe even in the afternoon session we can continue, right? So since I am only taking. So if you want to start, maybe the first two questions we should discuss, first two or three, then we go for lunch. Then we can also start little early today, 3 o'clock. Hmm? Yeah, it takes time. So post lunch discussion is needed. So first three questions maybe we discuss. बैठ के ही, हाँ,
फर्स्ट क्वेश्चन क्या था? अनमेट नीड ना सर द So the first unmet need was the lack of access to affordable health care.
हाँ,
So basically, in rural India, people do not have cannot afford the affordable health care. Basically, when we are talking from the bottom of the pyramid, and they cannot even address the severe illness at very initial stage. So the basic thing we can go for accessible to the healthcare, and the second thing is limited infrastructure in rural India. They cannot even get a clinic near to their location, and even if the clinic is available, the doctors are not available. And the second thing is during rainy season or some emergency, they cannot even get the access for the emergency purpose. So the second problem is this. The third problem is the shortage of trained healthcare. Even sir, recently you quote the example of our institute, IIT Kharagpur, even cannot even retain a trained doctor. So when we are talking about the rural India perspective, it is very difficult to retain the trained doctor there. Because of the remoteness of the locality, doctor cannot even stay there. The fourth problem will be the community awareness and education. The rural people do not have proper awareness about the children immunization and the basic and the very basic healthcare facility. They do not have any idea regarding that. So the awareness need to be reached there first. And the fifth one will be the financial barrier. They cannot even aware about the healthcare facilities and all those insurance. They do not have that idea, and they cannot even afford the timely treatment. When the emergency goes beyond the imagination, we cannot recover them at that stage. They seek the basic requirement, which is not even fulfilling their requirement. So the financial barriers also they addressed. And the affordable and inclusive health, you are talking about the value chain.
Okay, so we have seen about all the problems. So I'll answer the second half of the question, which is value proposition that iCure will be offering. So first problem was quality healthcare in rural India. So they have addressed that with low cost and with good quality of diagnosis that they can give. Next, they reduced the distance. They worked on the distance and they brought the diagnosis center to the village. And then there were many villages which were dependent on neighboring villages. So again, they solved that issue too. And when we are talking about BAMS doctors, so they cannot provide all those treatments related to tests and surgeries. So they shifted that also, that the villages which were dependent, they added that hub and spoke healthcare where they got more details about how they can diagnose major some issues
yes,
at
something.
initial stage also, which needs trained people, like trained healthcare workers in that particular area only, which can reduce the problem at initial stage
It
only.
is very affordable also. With 90 rupees, they.
That was only
Yes,
now
sir.
possibly it's something more than 200, but it's still, it is with that they get everything, the healthcare, test, medicine.
And this also gave many other benefits like leading to employment, because they are training many nurses and healthcare workers also. So that led to employment. And they are following all the guidelines at basic level, that how they can treat patients easily and with affordable rates and everything.
Yeah.
Yeah.
Yeah, Mike.
They are also providing the daily wage compensation type scheme, like providing the travel cost of the accompanying family member if there is a wage loss. And another
Daily
thing,
rescue.
they are also arranging the test facility along with that health center, so that in one day itself they get the test result.
Yes. That
Those
is a
things
big
they also.
problem, people lose so many days, they have to almost away from work, and that's the daily, the earnings are lost, right? And for surgery and all, people need to sell off everything and get into huge debt to do this.
So, coming to the second question, which is classify the types of services and benefits which provided. So, they are, as my friend told, they are affordable services, the healthcare sector, and they did a good initiative, which is mobile medical unit with the Vadwani Foundation. With the help of that, it's a moving van where they are distributing the medicines and all those things to the needy persons.
Yeah.
And with this, they set up their center near the railway station, so that it will be access to reach and all those things.
Yeah.
And they also done a patient survey, like how the patients, they take the sample usually for 25 to 30 years age, to diagnose the problem, like what is the
Early
patient,
stage.
early stage thing. And they also did the early detection of disease, so to save the treatment cost, so that they can have that cost factor. And the another thing they also utilize their resources optimally. They also have set the doctors for MBBS graduate to set up their clinic as well, near the because it will be easy for them. They also offered a competitive salary to provide
Yes,
the
at the same
doctors.
time, you should realize,
Yeah.
if I am from a small kind of town, it's very difficult for me to set up clinic in a big city like
Exactly.
Calcutta. So they found, he himself met lot of people, identified such doctors who are willing to set up in that area, and they offered that opportunity to them. I think most of the doctors are still with them.
Yeah.
They don't need, for each hub there is only one doctor,
yeah,
but that person, if they are living with their family in the nearby area, they don't have to travel to Calcutta or big place cities, right? So that's an opportunity. So all these people, the doctors and paramedics in the initial years, he as a entrepreneur, he himself interviewed and selected all of them, and he found women fine, but sometimes he even hired like people with 18, 19 years of age with little bit of training, because it's a big also income for the family. And so those kind of people who are motivated to learn more, this kind of, he recruited. Yeah.
And they also collaborated with Narayana Health, so that they can be continue professional education.
Training of the doctors. Yes. I just add a little bit before we go to the third question. There. Yes.
When we are talking about the as she mentioned about the Narayan Healthcare Center, which is based in Bangalore, they basically provide the heart health care.
No, they have now everything,
So,
multi-specialty.
they can collaborate with more CSR organizations when we are talking it from the value chain perspective.
Yes.
And where they can access to the more resources and
Yes.
they can leverage the more funding.
Yes, they have done that. Now
And,
over the years, they have
can
collaborated
recruit
with
the talent. The retention part is difficult, so they can recruit the new talent, and they can also create some awareness campaign in the rural area.
Yes,
So
that
that
they do
people-
with the help of NGOs.
Yes, sir.
I'll just show few things. Where is my slide? Yes, so value proposition, I think you have also mentioned. So doctor consultation, medicines, diagnostic, in-house this low-cost technology. Option to this partner hospital is also important. That some secondary tertiary treatment what they can do, and within the community, right? So they can resume work quickly, they don't need to travel a lot. Problems we have all mentioned, so there are, we all know, screening patients early, awareness, right healthcare information at the right time. This one I have not talked about, so that's, and it's not so much we teach in operations management, the type of services. So there are different kinds of frameworks. If you look at this is not coming up so well. Something happened here. Let me see. This file got corrupted anyway. So it will be there in the original slide. So broadly, this bottom thing is vacant here. So either it's a remote service or it's a place, the service is happening at the place, right? So it can be remote or not remote. Similarly, benefits type of benefit can vary. Type of benefit either through the product or it's primarily service through access. In this case, it's hybrid in both. So it's partly remote and partly physical. People are going. Similarly, the benefits, some of it is core service, actual doing healthcare, but lot of it is also about access, right? So it's kind of, so they are in multiple places. And if you look at, we normally classify services or products in this. So if you look at product characteristics, it's high volume or high complexity, or service delivery process, it's fully automated or fully personal, on-site or off-site. This is how we normally need to classify services. So in this case, you can see what types of services they are doing. Strategic decision choices, again you can talk, but I will just, to wrap up the discussion now, I will summarize. So choice of location hubs, this is important. Where do they set up the hub locations and what are the spokes, which is the kind of addressable area for them, what kind of technology equipment, this is what they develop. The capacity planning, manpower planning, scheduling, all of this is very important. And this service process interface, finally they are interacting with the people, right? So that's why they were very hesitant to go out of West Bengal, Jharkhand initially, because this area they know, they can speak the language, cultural norms are more or less similar. Healthcare, it's very local and difficult. So this is a choice, this is important. Then people and process, again people recruitment, as I said, recruitment of people was very important, and he as an entrepreneur himself did almost all the recruitment in the first few years. Then also slowly they also realized when they cannot spend a lot of money in creating new centers, right? So even the hub clinics, sometime hub clinics, I think they built some of them, but they were also using NGOs offices or school buildings and so on. And in the villages, they didn't build any facility, they were also using. So they had to talk a lot with the local villagers, panchayat people, and build that trust. Otherwise, nobody allows an outsider to come in village and set up like this, right? Plus, that's why when NGOs are working, they need to work with the NGOs. Suddenly, somebody cannot come and do these things. So those things were important. These are strategic choices very early they have to make. And then since I followed them over many years, then we wrote that other paper we will discuss towards how they kind of dynamically change some of the things, right, over a period of time, and how, but still always the question was in his mind was, shall we add more services to similar locations or keep the same services and go to different locations, right? That was the main question he was asking me at that time. So we did some work and helped them in that. So we'll come back after lunch and discuss the other things.